last year, 210,000 of children died of TB. And the issue of treatment of tuberculosis in children has been rather neglected for a couple of reasons. Children don't spread the germs, so they don't contribute to the dissemination of tuberculosis, so it's considered as publicly, in terms of public health, not that important, which is really absolutely regrettable. When we saw that the arrival of this drug, telamamide, as an additional possibility to treat children, then we thought it was extremely important to assess it. It's a game-changing in the treatment of MDR-TB in children because, as I say, up to now, the recourse was really having this conventional treatment of 18 to 20 months duration and very long and very difficult. So this addition of this new drug is really making a change. Without new tools, without new diagnosis, new drugs, new vaccine, we will not be able to defeat TB. But also without research, we will not be in a situation where we can improve the way that TB is being controlled in country. We have set up together with my colleague Lepiat what we call a toolkit, which is designing very, very precise, concise steps on how, at country level, where there is the most tuberculosis, the national program, together with the scientists and the researchers, should assemble, create a network of research, and then develop a plan. And this plan should become a national plan for TB research and should be a leverage to get government commitment, government funding, external funding, so that there is research be carried out so that the control of tuberculosis can be improved.
I want to thank you for the opportunity to speak about zoonotic TB because the union has had a very long history. We have a zoonotic TB subsection, and it was a decision to create a working group 2 years ago that has really led to the fruition of all this, again with the support of WHO, to really bring it to the attention of the global community. We don't know. What we don't know is that we don't have the good diagnostic test to differentiate bovis from tuberculosis. We don't have the good systematic surveillance that would be needed to actually say this is an accurate count of the number of cases. So the question is, so what? Now, from a clinical perspective for the actual patient, the organism is almost always 99.9% resistant to pyrazinamide, one of the main drugs for tuberculosis treatment. The other thing is that clinically, extrapulmonary tuberculosis is more common in this form of tuberculosis, and that means that the people can be misdiagnosed. And I think that we need to increase awareness and have official policies developed within countries so we do get the better diagnostics, the better surveillance, and investigations to find out what some of the risk factors are.